I'm going to show you the 5 mistakes that you should never make with knee replacement exercises. Welcome back, guys. My name is Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, I've treated many different patients that have had a total knee replacement, and one of the common differences that I can see when I compare someone who has recovered very well and someone who is struggling with the rehab is how they're actually performing the exercises. Now, most of you at home, if you have received this procedure, you've probably gone home with a handout or some sort of instructions on which exercises you should be working on. However, it is extremely important on paying attention to the detail with each of these exercises. Many people can do all of these exercises incorrectly, which can greatly affect how fast you're getting your range of motion back, and also how much pain you're experiencing while you're performing the exercises. And that's why in today's video, I want to clarify 5 mistakes that I see many of the most common exercises being done incorrectly, and we're gonna ensure that we make sure after this video that you correct those. Now, the first exercise that we're gonna get into that I commonly see being done incorrectly is the quad set or the leg straightening. And the reason why this is an important exercise is because this is a great exercise to help us regain function of the quadricep muscle. When you have that incision down the top of the knee there, a lot of the pain is going to inhibit the quadricep muscle. So it's important that we incorporate exercises that are going to activate the quadricep muscle. That's why this is extremely important. Now, with this particular exercise, what I've seen many people do incorrectly is that they are focused on straightening the knee rather than actively tightening the quadricep. And the reason why that's a mistake is because I can actually just push my knee down and I'm not going to get the proper recruitment of the quadriceps. Of course, you can see me straighten my knee out and you're going to see this muscle tighten and activate. But when you've just had this procedure done, you might be able to straighten your knee, but surprisingly, you're not going to feel a lot of the recruitment of the quadricep muscles. So in order to perform the quad isometric or quad set exercise correctly, I would prefer you to sit up, and I like recommending to my patients to watch what's going on with the thigh. Compare the opposite leg, which is a non-surgery leg, to your surgery leg and see, can I visually activate my quad and see the recruitment of the thigh muscles? That's going to ensure that you perform this particular exercise correctly and you don't make the mistake of just doing straightening of the knee, because surprisingly, you are not going to be recruiting the right muscles with this one. Now, the next mistake that we're going to get into is how you're performing the heel slide exercise. Now, if you're someone that has great pain management and you're not having a lot of pain, you may feel like it's a great idea to be moving your leg on your own without any assistance. However, if you're someone who has a lot of pain, you know for a fact that when you're trying to move your leg without any assistance, using your own active muscles, this is an extremely painful exercise. And this is why when we're performing the heel slide exercise, we want this to be passive, meaning that we are using a strap, we are using some sort of ace bandage or whatever you can use, maybe that's a belt, to wrap around your leg. And this will allow you to assist the leg moving up, and you can get more passive range of motion in the knee. Of course, you're going to be able to actively lift your leg on your own. However, you're going to have more success going further with your range of motion if you are using a strap and performing passive range of motion. So it's going to be imperative that you use assistance with this exercise. Now, moving on to the next common exercise that I see done incorrectly is the straight leg raise. Now, after we've gone over isolating the quadricep muscle, after we've gone over the short arc quads where we have a foam roll underneath and we're really focusing on straightening the leg, the next progression from there, which I've shown in many other videos, is the straight leg raise. And so people will typically start working on the straight leg raise and they think, well, if I can lift my leg, then I'm making great progress, right? But if you're lifting your leg without really fully keeping the knee straight, you're not really isolating the quadricep muscle like we're supposed to do with this particular exercise. So in fact, if you're performing this, you might even have pain and it might be difficult, and I'll see some people just forcing themselves, not even doing this correctly. So if you really want to make sure that you're doing the straight leg raise correctly and you want to isolate the quadricep muscle, you have to ensure that your toes are pointing backward and that you can keep your knee straight the entire time that you're lifting. If you simply don't have enough strength in the quadricep and you find yourself bending the knee, you're wasting your time, because now your lower abdominals and your hip flexors are taking over the exercise, and now you're not fully strengthening the quadricep. And you will use your time more wisely if you focused on the quadricep exercise, the isometric exercise, or even the short arc quad, if you're really trying to build strength in your quadriceps again. And then as you build more strength, eventually you'll have the ability to perform this exercise with the knee straight. Speaking of the knee straight, this brings us into our next exercise that I commonly see done incorrectly, is the knee extension. This is simply when we place some sort of roll or pillow underneath, and you'll see some individuals and they just perform this by laying flat on their back. And obviously if you're laying flat on your back and you have a pillow underneath, it might look like, wow, I have full knee extension. I'm able to straighten my knee fully. However, if you truly want to get full knee extension, it is best to sit up. This is going to change the orientation of your pelvis. And instead of lying backward, you're going to be sitting up, which is going to put a greater stretch and tension on the hamstring muscle. This will allow you to get full straightening the correct way, and straightening that's going to last for the long run. You'll see there's going to be a big difference compared to when you're laying down performing the stretch with the towel or blanket underneath the ankle versus whether you're sitting up and performing a stretch. You're going to feel a greater stretch on the calf and in the hamstring, but over time this will get easier and you will be performing the exercise with the proper form. Now, the last common exercise that I see can cause issues for many people if they do incorrectly is the mini squat exercise. Now, I love the mini squat exercise. I think it's one of the greatest exercises for rebuilding strength in the quadriceps, especially in a weight-bearing position, meaning that now you are standing and putting weight through the surgery leg. However, many people do this incorrectly because they're causing too much flexion or bend in the knee, which is going to create more pain in the front of the knees there. So what I commonly will see people do with the mini squat, essentially a mini squat is when you're lowering your waist down towards the ground, almost like you're getting ready to do a squat or a standing up from a chair, but simply they'll kind of drive their knees forward. So they're more upright. If you notice me from the side, is they just stay upright and they go straight down with their hips, and that will increase the bend on the knee, but it's going to cause a lot of pressure on the knee. There's no incorporation of the hips. There's no really using your glutes or your hamstring muscles, and that's where this exercise can be extremely powerful. So that's why instead of keeping your trunk upright and just going straight down, what you want to think about is actually driving those hips backward, almost as if you're imagining like you're sitting back into a chair. So let me show you one more time. There's a big difference between when I squat and I just go straight down. You even notice my trunk kind of fall forward. But there's also a big difference between me now incorporating my hips and bringing my hips backward. That creates a less bend in the knees, but also allows you to stay balanced over your feet. And it's going to be less stress on the knees and less painful as well. So those are the most common mistakes that I see people make with these particular exercises that are commonly prescribed after knee replacement. And you'll see in time, just being more intentional about the details with each of the exercises can make a huge difference when it comes to increasing your range of motion, reducing your pain, and overall getting that knee back to normal. Now, if you want more information on how to properly rehab your knee after this particular surgery, make sure to check out my surgery series that I've listed here on my channel. And you'll have tons of resources on there about what exercises are best for range of motion, what exercises can help with strengthening, and even what exercises can help with if you're dealing with stiffness. As always, I appreciate you for stopping by to watch this video. If you want to support me, you can subscribe below, and I'll see you in the next one.